Hi, welcome to Suman TV viewers. I am Dr. Chava Anjaneyulu, Chief ENT Surgeon at Asian ENT Care Center located in Panjagutta, Hyderabad. Throat pain, that is pain in the throat. It is a common symptom. Almost all people will have experience of throat pain in their lifetime. But nowadays, throat pain problem is more common. Many people are having continuously throat pain. Throat pain may be due to infection and inflammation. Common infections are viral infections, bacterial infections, sometimes fungal infection, especially candidiasis in diabetic patients. Inflammation, that is not infection. Inflammation means inflamed tissues, redness or edema of tissues that may cause the pain in the throat. Inflammation may be due to smoking, alcohol intake, pollution in the air pollutions, more stress to the throat with more voice usage, and gastroesophageal reflux disease. These are the reasons for the throat pain. Especially in children, recurrent throat pain is due to infection of the tonsils, enlarged inflamed tonsils. Sometimes it may happen in other age groups also, but more common in children. If they take cold food, that cause the irritation of the tonsillar mucosa and pharyngeal mucosa and add to the secondary bacterial infections. And in children nowadays, throat pain may be due to allergy also. Allergens in the air may cause inflammation in the throat mucosa, along with the cold problem. In cold, usually these secretions will go into the throat and that also cause the inflammation. Smoking and spirit, alcohol intake will cause the inflamed mucosa and that also cause gastroesophageal reflux. Acid reflux will cause inflammation of the tonsils and pharynx. It causes the throat pain. Smokers, always we have to think about the carcinoma, because smokers and tobacco chewers, there is a chance of carcinoma in the throat. You should thoroughly examine if they have the throat pain. Mainly we can reduce the throat pain problem by the precautions. Mainly frequent water intake. Don't make throat dry. Take little bit water more times. Don't dehydrate the throat. While speaking, speak slowly. Don't speak continuously and in loud voice. Avoid spicy food, oily food as much as possible. That will reduce the chance of gastroesophageal reflux disease. And if you have gastroesophageal reflux disease, don't take food, because full food intake cause reflux more and more throat problems and more foreign body sensation and more throat pain. In children, if they are having a recurrent sore throat with enlarged tonsil, it is always better to remove the tonsils. So infection if goes out from the body, children become very healthy. In adults also, if they are getting recurrent tonsillar infections, remove the tonsils. Rarely, throat pain may be due to the styalgia, that means elongated styloid process. If that is there, remove that elongated styloid process and a patient will get a benefit and their pain will come down. In diabetes, if you find candida, white patches is the problem, use antifungal drug for 4 to 6 weeks and it will come down. Herpes simplex is another reason which causes the recurrent infection in the throat. You can find that herpes simplex positive by blood test. If the herpes simplex is the reason, use antiviral drug for a few days. And making good oral hygiene will reduce the chance of throat infection and your throat infection rate will be very less. If you have any recurrent throat pain or persistent throat pain, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Suman TV channel.